Recently I made a video estimating the deaths in Ireland from COVID-19. I estimated that many of the deaths are not from COVID at all, leading to the conclusion that even if nobody dies from COVID, we would have COVID deaths, and thus never ending the excuses for all of the measures we see against COVID. As part of the estimation of deaths, I turned to census data from 2016 to estimate death rates above and below the median ages of deaths to account for nonlinear increases in death rate with age. I later realized that I missed an obvious step. I took the decline in population from one age to the next as a stand-in for a yearly mortality rate, but I did not compare the death totals such an assumption generates with the actual deaths in 2016. When I did, I found that the predicted death rates were too large and predicted too many deaths. I have now scaled them back by appropriate factors. Now I can make more conservative estimates, although my main conclusion is unaffected. I decided to look at data going back to July. Before July, the data for deaths with comorbidities is not well defined, so I did not look back earlier than July. It is interesting to see that the estimated deaths from COVID only remain steady at 12% of the total for the whole period, but the comorbidity only deaths go from about 30% to 40% of the total. There could be a day where 88% of the COVID deaths are not COVID deaths. We could be there already. I applied the calculation method to the difference in deaths and cases from July to October. In that period, there are about 180 deaths and 36,700 cases. My estimates predict more deaths than there actually were. I therefore estimate that 82% of the deaths in the period were not actually from COVID.